Hello, everyone, and welcome to today's event. We're so glad that you could join us today for the SLF Pride Talks. My name is Healy Thompson, and I'm the Senior Manager of Advocacy at the Stephen Lewis Foundation. Before we jump into our conversation with our three speakers today, I just have a few things to cover. First of all, we welcome you to use the chat today to introduce yourselves and to engage in the conversation. We recommend that you select everyone from the drop-down menu so that everyone in attendance can see your conversations. Also, because today's event is only 1 hour and we have three incredible speakers, we're not going to be doing a separate Q&A section. That said, we do encourage you to submit questions through the Q&A feature during the event, and I'll do my best to incorporate those into the conversation. Now, as we get started, I would like to start with our land acknowledgement. As an organization based in Canada, the Stephen Lewis Foundation acknowledges that our presence here is a direct outcome of the settler colonial state, whose policies of expulsion from the land and cultural genocide continue to impact Indigenous communities today. I am joining today's event from Waterloo, Ontario, Canada, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Neutral peoples. This region is situated on the Haldimand Tract, the land promised to the Six Nations, which includes 10 kilometers of land on each side of the Grand River. As settlers, we have a responsibility to honor the treaties established on this land. This area is, in part, governed by the Dish with One Spoon Treaty and the Two-Row Wampum. The Stephen Lewis Foundation acknowledges that oppressive and inequitable socioeconomic and political systems in Canada continue to perpetuate a legacy of racism, intergenerational trauma, and structural inequality, and that this legacy is directly linked to the disproportionate impact of HIV on Indigenous communities within Canada and the homophobia, transphobia, and violence faced by Two-Spirit and LGBTIQ Indigenous people in Canada. These ongoing forms of colonialism in Canada are linked to the ongoing colonialism in many parts of the world, including the countries in sub-Saharan Africa where SLF partners work. We at the Stephen Lewis Foundation are committed to working in solidarity with our community-based partners as they face the continued effects of colonialism and the HIV and AIDS pandemic in sub-Saharan Africa. This includes the colonial legacies of homophobia and transphobia that we are discussing in today's event. As we work in international solidarity, the SLF is also undertaking a journey of ongoing learning, reflection, relationship building, and solidarity with Indigenous communities in Canada. So today's event, The Right to Health and Healing, is part of our SLF Pride Talk series and the culmination of a week of fundraising activities through our Dare to Self-Care campaign. For those of you who don't know, Dare to Self-Care challenged folks to join in activities to promote their well-being while also raising funds to support the vital work of the Stephen Lewis Foundation's LGBTIQ partners in Eastern and Central Africa. For Dare to Self-Care, the SLF community participated in group wellness sessions, including sound bath meditation, yoga, and self-reflection activities, while learning about the work of each of the organizations that will be speaking today, Farug, Hoimas, and IBU, and raising funds to support their work at the intersections of health and human rights. Thank you to everyone who participated in Dare to Self-Care, to the community members who volunteered their time to run those activities, and to my colleagues who organized the events. We end Dare to Self-Care Week on the eve of Pride Month in many parts of the world. As we get ready to kick off the celebrations, advocacy, and community building of Pride, it feels completely fitting to focus on the work of three of our LGBTIQ partners, partner organizations who are at the forefront of movements to promote mental health and well-being for human rights defenders and other members of LGBTIQ communities in Kenya and Uganda. Before I introduce our three panelists today, which I will do in just a moment, I want to briefly introduce a project that we have been collaborating on together. the right to health and healing, strengthening LGBTIQ movements in Kenya and Uganda through community-owned mental health care and well-being support services. This is a 2-year project that responds to the immediate needs for inclusive, quality mental health and well-being support for LGBTIQ leaders and community members in Kenya and Uganda. The Stephen Lewis Foundation in Canada and 6 partners in Kenya and Uganda, Farug, IBU, Hoimas, SMUG, HAPA Kenya, and Mayago, jointly developed this project. This project is supported by the Act Together for Inclusion Fund, or ACTIF as we call it, which is funded by the Government of Canada through Global Affairs Canada, and is managed by Equitas in partnership with Dignity Network Canada. This project is also co-funded by a longtime supporter of the SLF and our LGBTIQ partners, Doug Stollery. So you'll hear some references to this project in today's discussion. I am now going to be introducing our 3 speakers. I'll be reading shortened introductions for them, and my colleague will be sharing their full bios in the chat. So Sanfuka Jonita Wari is the Executive Director of Freedom and Roam Uganda, or FARUG, a lesbian, bisexual, and queer, LBQ, diverse persons organization that advocates for the respect, protection, and fulfillment of their human rights and reinforces feminist culture and narrative. Over the past 11 years, Jonita led the LBQ community by empowering its members and seeking synergies between the LGBTI and feminist movements. Next, we have Felix Cassandra, popularly known as Mama G, who was a human rights defender, HIV champion, and a paralegal at Hoimas, Kenya. He has over 5 years experience in training and sensitization of healthcare providers, law enforcement officers, religious leaders, and the general population on issues affecting LGBTQ people and other key populations. Mama G is also a community researcher and has been involved in various research projects focused on key populations in Kenya. And finally, we have Luswata Brant, who is the Executive Director at Icebreakers Uganda. Brandt has been advocating for the rights of LGBTI groups in Uganda since 2009, first as a volunteer at the Hate No More campaign committee, hosted by Farug. From there, he became an active volunteer at Icebreakers Uganda, and then was hired as the clinic and research manager, a role that he filled for 6 years before being named the executive director of IBU. So, welcome and thank you for joining me, Wari, Mama G, and Brandt. It's going to be a fantastic conversation, and folks are so lucky to be getting to hear from you today. I want to start with a question for you, Brandt, to set us up here. So at the beginning of this ACTIF project, Icebreakers conducted a needs assessment about the state of mental health among LGBTIQ Ugandans. Can you give us an overview of this assessment, your key findings and recommendations from it? And I guess one of my big questions is, are LGBTIQ Ugandans currently able to access mental health, the mental health support they need in inclusive environments?
Thank you so much. Good evening from Uganda, and then good morning to other countries. My name's Luswata Brant. I work with Icebreakers Uganda as the executive director. And also, I sit on the Pride organizing committee, so happy Pride. We are here, and I will share towards the end the roadmap to Pride, because actually we want to see Pride happening. And in Uganda, this marks the 10-year anniversary of Pride. So I'm happy to be here, and thank you for the question. At the beginning of this project, in Uganda, we have been having a challenge of mental health challenges towards LGBT community. And then actually, when we started actually our relationship with SLF, we had conversation about mental health, and now we can serve better the community in Uganda towards the mental health challenges. And one of the activities we did is actually conducting the needs assessment to see or to get the challenges, to get the views, to get the issues of LGBT persons facing mental health challenges. And actually by the time we had a challenge of addiction, so we wanted to know, to find out the current needs, strengths and gaps in the local mental health systems in Uganda. The methodology we used under this assessment, we used focus group discussions, because actually when we thought of actually having one-on-one, it was not quite effective. So we decided to carry out a focus group discussion so that our community members, the LGBT community members, actually complement each other while carrying out this assessment. The assessment were involved with 25 participants across the LGBT acronym. And then the findings were, the challenges were, or the needs and the gaps were, one, we found out that the challenges were stress, anxiety, depression, loneliness, suicidal thoughts, and madness. And then these findings actually brought about the very many challenges that LGBT community face. For example, we had the pandemics. For example, the COVID-19 pandemics. We have the unfavorable laws and policies in Uganda. We have the poverty, the socioeconomic of LGBT persons. Many people are not employed. Maybe because some of them are because of their sexual orientation, some of them because of the violations they're facing because of LGBT persons, and some of them are because of being stigmatized or facing homophobic. You know, in Uganda, being HIV positive and then being coming from the LGBT community, that is double stigma. So this assessment helped us to know the gaps, to find out the mental health challenges, and to know the strength or the way forward when it comes to mental health, addressing mental health challenges. Sorry about that technology. So the findings, one of the findings I've talked about is emotional distress. There's a lot of emotional distress in Uganda. One of them because LGBT community don't know where to go to seek for mental health services. Yes, as LGBT persons organization, we have mental health services, but it's not a one-stop shop, I would say, because we have cases that we cannot handle at the center or at the mental health organization. There needs referrals, but do our community members know where to go for those mental health services? No. We found out that there are a lot of gaps when it comes to mental health programming in Uganda. And actually, even if the LGBT organization can address some of the mental health challenges, but we're limited maybe to funding or to some situations. For example, if someone actually is facing, say, suicidal attempts, is facing trigger, it's facing actually, it was, for example, if it wants to also do harm reduction, you might find that at services at IBU, we are not at stop shop. You might find that services at Freedom and Roam Uganda, they are not actually up to one-stop shop. It needs referrals. And then some of these centers do not know, are ignorant about LGBT programming or LGBT mental health. Yes, so what did we do? We saw that there was a lot of, also in the findings, we saw that there's a lot of stigma when it comes to mental health. There's a lot of stigma, there's a lot of victimization, there's a lot of social inclusion, there's a lot of mental health challenges. Because, for example, you remember the first, the research that came out that actually all the LGBT persons are mad. You understand? Yeah, and then we found out that actually there are some cases where we interviewed people in the focus group discussion, and they said when I was referred to the National Psychiatric Hospital, that is Butabika, I was actually put in the sector on the cluster of mad people. Yet I'm not mad. Yeah, because these are mainstream organizations deal with mental health. They don't know how to handle mental health challenges, more so the LGBT persons undergoing the mental health challenges. We saw there's a lot of stigma and discrimination. Yes, I've been referred to your clinic for mental health services. Remember, I'm also taking my ARVs, or I'm living with HIV. And you find people not knowing about how to handle issues. We got cases whereby someone missed medication for 5 days because they thought he was mad. And this is a high time we start and speak about mental health, because we've lost many people. We've lost many of the LGBT persons to mental health. We've registered death. We've registered depression. We've registered people non-performing at their workplaces. And because you're a boss, you go in this office and you blast them, not knowing they're also going through mental health challenges. So this assessment really informed us on what needs to be done in order to fight the epidemic, or to fight the crisis called mental health, or to learn how to live with it, but positive living.
Thank you.
As I conclude, yes, actually, as I conclude, what we did is actually, we are out of the assessment, we now came up with a way forward. For example, mapping over health service providers that deal into mental health service delivery. This was between two people, the LGBT organizing and the mainstream. When we mapped out, we saw that actually we tried to talk to our partners that look, people are going through mental health challenges, people are going through mental health disorders, people have this mental health, but can you please open doors for LGBT persons to seek these services? Of course, I would not go too much in detail with what came up with the mapping, but at least now, out of the 15 or the 5 organizations, LGBT organizations that are carrying out mental health challenges, we have now brought on board a few people that actually open doors. For example, in the National Psychiatric Hospital, that is Butabika Hospital, now we have a person we're working with, they know that actually it's just an understanding, not with the institute, but with only that person. So we have a memorandum understanding with that person, whereby whenever we refer someone, we just call or write a referral letter that, at IBU or Farouk or what, referring some funds for such and such a service. And that's a win with us. We've actually we've also come up with safe centers. For example, now IBU has a mental health hub whereby people come, rejuvenate, sit, talk of, carry out sessions for mental health, and then see the way forward, and also get actually sit close with other people that help them come out. Because you don't speak about mental health, you can face a lot of challenge. So for now, I'll stop there. Thank you so much.
Thank you so much. That was very informative and rich. And one of the things that you talked about that really jumped out at me was the overlapping and intersecting forms of stigma that people can face, right? Facing stigma already as a member of the LGBTIQ community, facing stigma as someone living with HIV, and now facing someone who's needing to access mental health services. And so the work that IBU is doing and that you're doing, Brandt, to bring people together to break down that stigma and to identify those people who are safer to go to for mental health support, where you won't be stigmatized for being an LGBTIQ person, it's so valuable. And I know we'll get to hear a little bit more about it soon. Right now, I wanted to turn to you, Awari, because I think that what I'm going to ask you really builds on some of this conversation about community and about addressing stigma that we were just talking about. Farouk always has really engaging public content. You share so much through your social media. You had an incredible podcast series. And in this project, you've developed and shared widely monthly wellness journals. And I was hoping that you could tell us about these journals and about the responses that you've gotten from LBQ community members and other organizations about them. Sorry, you're on mute, Lori.
Good evening from Uganda, East Africa, in some parts of Africa, but good morning and good afternoon to the rest of the world. So my name is Semfka Janita Wari, commonly known as Biggie, but I work with Freedom and Roam Uganda as the team leader. Yeah, mental unwellness has been a vice in the community without us speaking about it, because we didn't know the approach towards supporting our communities, but also just the community generally. Because being mentally unwell was stigmatized. You were discriminated. So in regards to our, why we came up with journals, we had to look for ways through which we would interestingly support each other, support our communities, support our communities to overcome unwellness. Indirectly, we were having plans, we were scheduling wellness plans through the journals. The journals speak about exercises. The journals speak about physical wellness. They speak about healthy eating. They speak about motivational listening to feed your mind positively. So generally, while we speak about mental wellness, it entails all that. You must eat well. You should listen to positive quotes or positive music or positive stories to feed your mind, which was not even common, but also healthy eating. How do you exercise? Did you know that exercise is part of your mental wellness? Did you know that eating well is part of your mental wellness? Did you even know that listening to beautiful music or podcasts, while I speak about me as a lesbian woman, how grateful I am to support a lesbian woman in the rural area to adhere to their medication, to be able to put a smile on their face that they are able to get their medication. They are having nutrition support. So the journals entail all that. So at one time, we will share a bit of physical wellness, exercises that will help enhance your mental wellness. And then at one point, we'll speak about eating habits, health eating habits. Those also affect our mental wellness. You know that sometimes when you're stressed, some people are stress eaters, you get. So through the journals, we share how well you can keep up with the work that you do, but eating well. On top of that, we have the podcasts. We share readings, we share spiritual messages that will enhance your mental strength. Because just by listening to spiritual healing songs, that will help you as a human being. And that's what we were lacking. All our activities, all our projects were aimed at community, even the people giving services to the community, like the staff members of Freedom and Roam. Now they have an opportunity to think about themselves before they look at the persons they're giving services to. So it's quite interesting for us to come up with mental wellness journals. Quite interesting is that most of the organizations that we work with or we partner with, especially those that we partner with in the DAV consortium, we have a DAV consortium that brings together LGBTQ organizations in order to resource mobilize, so that we as Farouk, we always carry along other organizations. They could be new, they could be old organizations, but not old as us, but they are struggling financially. So while we seek funds from, say, Stephen Lewis Foundation, our services go towards all LGBTQ leaders who are dealing with communities that are suffering with mental unwellness, but also their membership. So collectively, all our engagements bring together LGBTQ persons, leaders, and also beneficiaries to share with them mental challenges, but also how do we maneuver through. So organizations like Rights for Her, that is closely working with us, part of the DAV Consortium Men's Initiative that focuses on labor rights. And then WERO, which is an LGBTI organization that focuses on LGBTQ sex workers. They are learning from what we have. We share with the organizations. So that is the feedback we get. And surprisingly, some of our partners are benefiting from the journals. For example, Womankind International, they have adopted the journals. They use the journals in the work that they do. How nice. So they learn from what we do to also support the people that the persons that they work with, but also the partners that they work with, because they work with a diverse group of persons. We have one of our lovely community member, but also a funder, because they work with a funding organization, Muhai. They're using the journals. They're going through a hard time around cancer. They're battling with cancer, but they're using our journals. The journals are assisting them to maneuver through this situation. So that's how lovely the journals are. Through physical exercise, through mental wellness, listening to podcasts, reading, group reading books that will help you, rejuvenate your mind, focus you on things that will help your mind become better, which we used not to have in the past. And then also eating well. When you don't eat well, it affects your mind. So these are some of the positives that we're receiving from our partners, but also our members. Thank you so much.
Yeah, that's fantastic. And there, you like Brandt covered so much, and we will be coming back later in the conversation to a couple of things you mentioned, especially mental health support for leaders, right? We'll talk about that. And then also the movement building and the sharing and the coalitions. Right now, I want to pick up on the kind of the holistic approach that you were talking about to dealing with mental health and well-being, and that you talked about, food and exercise and community building all as part of that. And Mama G, as I turn to you, I want to look at another side of that holistic approach, which is about addressing some of the structural issues that could impact mental health. And so in a recent report to the SLF, HOIMAS reflected on some of the challenges related to the therapy sessions you've been offering. And one of the things that HOIMAS noted was, and I quote, "Continuous exposure to the element of their mental stress is a huge challenge," end quote. That is, trauma related to homophobia and transphobia is ongoing in people's lives. And I was hoping you could talk a bit more about this and some of the other things that HOIMAS is doing or wants to do to address this holistically, such as assertiveness trainings and increasing social and economic opportunities.
Hello, everyone. My name is Felix Cassandra, and I'm well known as Mama G. I'm a human rights defender, and I work at HOIMAS as a paralegal currently. And maybe to add on that, personally, I'm a victim of mental illnesses, and that's why I'm part of this team today. It's not that my director is not around, it's just around somewhere around the corner with me, but since I'm the victim, and I understand what mental health means to me, and on behalf of LGBTI community and someone living who have been living with HIV for several years. So at HOIMAS, HOIMAS is a male sex worker-led organization, LGBTI-led organization. We are working with both MSM and MSW, but we came to realize that mental health is a challenge, and most of us are victims of mental health problems. And we are now currently trying to see how best we can overcome it and how best we can solve our mental illness among our staffs and amongst our beneficiaries. One of the things which we are doing right now is to capacity build our beneficiary as well, so that they have the information, and also to create awareness about mental illnesses, because we also came to realize that our community doesn't want to be associated with mental illnesses. And currently we still don't know the reason behind it, because everyone say they will tell you, I'm okay, and they're not okay. It's only maybe a few of us, like Mama G, who have come out and say, to be honest, I'm a victim of mental health. The entire of last year, I went through trauma, I went through depression. I was nowhere to be seen. I went somewhere around Western region. I've been looked for by my fellow staff. They looked for me all over. I was nowhere to be seen. I don't know what was happening to me. I decided to quit the job. So when I came back, I'm also a beneficiary of a mental health program at Hoimas. I'm still going through the session at a facility called Madare. So I'm part and parcel of the program, which is ongoing for mental health illnesses. I'm also, I can say, I'm also trying to help my fellow staffs to go about mental illnesses, because I've been a victim. So at one point, I also try to talk to them and make them understand how mental health can affect someone, because people don't understand. Currently, few people are only people who can understand what is mental illnesses and how it can affect you, and what is trauma at the same time, and how trauma is related to work and LGBTI community, and how homophobia also contributes to that. You realize, like when you are in Kenya right today, we experience stigma and discrimination in our entire life. When bothering a matatu, when going to shop, when going to the stores, maybe to buy food stuff, you are being discriminated. And this is really contributing to our mental well-being and trauma every time and again. Because you are being discriminated, you are being abused every time and again, you have no one to talk to. Everyone behaves like they are beyond the laws. But we've been trying to training our police officers in our facility so that they can get also to understand us. So we also been trying to fighting these mental illnesses with the police in our region. Currently, we also came up with an app. It's called Going Online, where people can reach to psychological counselors. It's not necessarily that they come to the facility, because we realize some people just decide to lock themselves in their houses and commit suicide, or they have no one to talk to. So what happens with this app is that you can access it. We just share the link. It's on Facebook as well. So you can just access it, book appointment in case you want to come and see psychology, our counselor, maybe physically. You just book appointment. If you don't want to come and talk to him like physically and you are still not okay, it's okay with that. You can just talk to him and chat with him through our social media. So currently, those are the things we are doing. We are also trying to partner with other government facilities for referrals, because we have people who have gone above, they have advanced mental illnesses and trauma, so which we cannot handle as a CBO organization and as an organization as well, because of other reasons, maybe financial reasons and such kind of things. But we also try, we are referring to public facility, whereby they have professionals which can deal with advanced mental issues at their facility. Another thing which we are also doing, we also trying to link our community to other partners in case of maybe there is scholarship, such kind of things, and maybe such kind of things. We also have a full-time counselor at Hoimas, where our staffs can access anytime, any day. It's 24 hours. You can just access all the services in case you feel you are not okay. And we also have a criteria whereby we have our programs, whereby if you feel like you are not okay, maybe coming to work, you are allowed to excuse yourself from coming to work and come maybe a day after when you feel like you are okay. Because we also came to realize that these are some of the things which are also triggering mental health illnesses. Like if I feel like I'm not okay today, why would you force me to come to work if I'm not okay? I'll just excuse myself and maybe make a phone call and ask my programs that I'm not feeling okay. I'm feeling down, I'm feeling depressed. Please just give me this day so that I can relax and come back to my senses. Then I'll report to the work day after. Thank you.
Thank you so much, Mama G. Thank you for sharing your story with us. It's so important in addressing stigma for people to be able to talk about their own journeys with mental health and with mental illness. And it's very clear that you are a role model and a champion for your peers. And we really appreciate you sharing your story today with us. And the way that you ended when talking about the ability to call in and take a day when you need to for your mental well-being, not just when you're physically sick, but when you mentally need that space, as a leader in the community, leads us perfectly into the question that I have for you, Wari. I told you we would come back to this question of leaders. And I want to start with a quote that Farouk shared in a recent report to the SLF. So this is, and I quote, "Well-being is a feminist and political act. And as such, we have started giving ourselves permission to take care of ourselves, take a moment to break, relax, and rejuvenate as a way to mitigate stress, anxiety, and burnout that comes from our work." Through this project, Farouk has been doing monthly staff wellness activities and hosting regeneration circles for LBQ leaders and activists. And I was wondering if you could talk a bit more about these activities, why they're needed for leaders, and why a holistic approach to mental health is so important.
Thank you so much. While you are reading the quote, I was just feeling it. And because while we are coming up with it, we needed to be holistic and intentional when it comes to mental wellness. I want to share a story that in 2018, we embarked on a journey of a culture at Freedom and Roam that is not common elsewhere. Who says an NGO has to operate in a certain manner? Who says that if I sit in office for 4 hours, I can't do the work that I have to do? Who says that if I wake up at 6 a.m. and I leave office at midday, I have not accomplished what I have to accomplish? So for us at Freedom and Roam, it's our culture. Monday is a wellness night. It's a wellness day. We work from wherever you want. Even if you're seated in a bar, even if you're seated at the mountain, even if you're praising somewhere or near the lake or something sort of, Monday is a wellness day. We work from anywhere, unless there's a critical meeting that needs us in person. And we are demystifying, we are like, this, who says that Mondays you have to be in office? Why can't I do everything I have to do on Wednesday? Can't I do everything on Tuesday? Oh my God, what about Thursday? If I do things on Thursday and we accomplish it, you are our donors, you know that we deliver. You know that we deliver. Regardless of the time that we have on Monday, Monday is our wellness day, and that's our culture at Freedom and Roam Uganda, because we care of how we feel. We care of our mental wellness. We listen, we become automatic counselors, even when we are not qualified to be counselors. But imagine someone wants to speak to Wari. They'll come to office, they want to speak to Wari, or they want to speak to Gloria, or they want to speak to Frank, they want to speak to Arthur, they want to speak to Fiona. They will want to speak to Ruthian. They will want to speak to Wami. They will want to speak to Leah. They'll deliberately want to speak to Arthur. Are you gonna stop them? Doesn't that make me a counselor indirectly? Aren't I giving a service to someone? Are you caring for my mental wellness? That's why we were deliberate in seeking for support for us as the people who are at the forefront. Much as we care for the people that we work for and work with, we also need to be well. When I'm unwell, whom am I speaking to? Everyone thinks as a director, you have the solutions to everything. Do I have the solutions? No. Do I have someone to push me to drink water for my body? No. Is there someone who wants to push me to go to the gym? Nah. So we decided to have a collective healing as staff. We are deliberately caring for each other. Because I stay up at night and we are working on a proposal, I'm on phone with Gloria. Hey, Gloria, there's this activity. What did we do? And Fiona is calling. Where are the receipts? What is this happening? All that. We end up sleeping at AM in the night. But then at 8, we are supposed to be in office. Are we really truthful to ourselves as feminists? Is that what we learn? No. That's why we decided to have collective wellness. We go out for lunch once in a while. We don't have to cook. We don't have to have someone running around looking for tomatoes, onions, salt, what? We just go out. And thank you for that. Thanks for this project that we are able to go out and let people, no one is going to run around to look for onions and all that, but to sit down. We laugh about things. We look at the meat and like, oh my God, today I'm having beans at the restaurant. We didn't know how important it is, but at one point when we went out, we realized how nice it is to eat together. At office, during lunch, I have a report. Gloria is having a meeting. Fiona is dealing with something. Delan is dealing. There's an emergency. A paralegal is running around. We don't have time for each other to speak to each other and feel and talk to each other to understand what are you going through. We have psychosocial support available, but who supports us? Often we are referring people for support. Then when do we refer ourselves? No, we don't refer ourselves. What happens to us as the persons at the forefront? We end up into substance abuse. At the end of the day, we are judged. Oh, you as a director, you can't be drinking like that, but do you understand what I go through? Quite challenges. So when we looked at all that, we decided to have collective healing. Rejuvenation circles. Rejuvenation circles are those circles where we speak about the challenges that we go through. As a director, everyone expects you to know it all. No. My success and whatever I do is whoever is around me. That one has experience in financials, disputes, there's someone who has experience in running around for emergencies. Someone has experience in paralegal. So together, collectively, if we have a dinner together, we are chatting about that. Like, oh my God, yesterday I found it hard. I was getting on a bike, and you know what? When I called Gloria told me, no, don't waste your time. Call this other guy, and then things were dealt with. Imagine. We used to work in isolation, yet we are all staff members of Freedom and Roam. But having these chats made us more close, understanding each other's hustles, how they struggle, and how collectively we can support each other. It has helped us. At one point, we are having lunch together from a place who no one is cooking. Even the welfare person is part of us. At one point, we are going to the sauna together. We are all trying to breathe well, feel it for those 2 hours, and then go home, have a nap. At one point, we are having workouts. We are running on the treadmill and we're like, I do 30 minutes. So someone has never done 30 minutes, but they are trying and they make it. They do 30 minutes. Can you imagine? If we continue doing that, how much energy shall we have in offices to be able to deliver to the people that we are supposed to serve? One point, we are just out there laughing, watching a band, listening to music. We never do that. We all are different characters, but if it's collectively enabling us to listen, we all come together. We'll go watch a band, listen, watch, smile, dance with each other. Some of us don't know how to dance, but because we are collective, all of us are there, we dance together. So the impact of collective wellness, especially for the people who give services, is quite important. Me as a leader, I now know how to sit with myself. And I advocate for that because I mentor fellow LBQ persons. I am passionate about LBQ persons, but it doesn't mean that I don't nurture other acronyms of LGBT. Brandt is one of my mentee, and if there was time, he would tell you the story of how I nurtured him to become as bold as he is. I still love each and everyone, but I know there's limited space for LBQ persons. So collectively, when you do things, you come down as a leader, you're part of the welfare, you're part of the security guard. All of you are just enjoying this music. All of you are having fun in the steam. There's no distinction between the director and the security guard, because at the end of the day, all of you are human beings. When you're stressed, all of you are equally stressed. Probably I'll come in office and I'm stressing each and everyone, including the security guard. But if we collectively speak about unwellness and speak about solutions, we will all be able to look at ourselves tomorrow and we're like, yeah, I understand your hassles. You see, the regeneration cycles give you room to speak. They understand what I go through as a director. I also understand what a security person goes through. Also a welfare person, when someone just gets food and just dumps all the plates just there, and yet they're supposed to drink, they're supposed to clean all their plates. I understand their hassles. I understand how they feel when someone, even with a sign that shows that you have to leave it clean as you found it, and the person just dumps the plates there. I will understand how they feel when the plates are dumped there. So collective healing, that's the reason as to why we prioritized it. We want to collectively heal. And thanks for the project that believed in collective healing. It's quite an amazing, and there's a lot of connection amongst us. We love more of ourselves, each other. Yes, we used to love each other, but we didn't know how important it was for me to feel your pain and for you to understand my pain and how I can help for you to deal with the situation that is unbearable, maybe during a particular period of time. Thank you.
Thank you. I don't know, you were speaking, so you probably didn't have a chance to see the chat, but what you were speaking about really resonated with our audience. There were quite a few people commenting on loving that approach that Freedom and Roam is taking, this collective healing and the feminist approach to supporting staff and really being a team. And what you were talking about, and also Mama G, what you were talking about earlier about your own story and sharing it with your coworkers, it reminds me of one of my favorite quotes, which is, be the change that you wish to see in the world. And really modeling that and knowing that as urgent as the work is that you have to support community members, you have to support each other as leaders and yourself as the leader to be able to continue that work, but also to model to others that their mental health and their well-being matters. You do it for you and they can do it for themselves. We only have 10 minutes left, 11 maybe if we're generous. And so I'm going to switch gears just a little bit, Mama G, if you will, with me here and come back to you before I go to Brandt. So Mama G, Coimus noted in a recent report that since you started offering mental health sessions, there has been improved consistency with people attending their clinic appointments for sexual and reproductive health and rights services. And I'm wondering if you can talk a bit about the importance of mental health support to overall health, especially as it relates to HIV prevention, treatment, and care.
Thank you so much for that question. So maybe to add on, what I can say is that this program has really helped our community members, because our commodity uptake has really gone high when it comes to condoms and lubricant, because people are now accepting themselves slowly by slowly as we keep on giving information about mental health and sessions. So these are really improved at our facility, and even people coming for the session for mental health illnesses has really improved, and even for the referral. So I really appreciate and acknowledge that really the program is really working for us as a community, because we've seen even people nowadays coming out and say, yes, now I acknowledge, I think I was going through mental illnesses. And even with our team, the staff team, they have really accepted and understood now that there is mental illnesses. There is no one who is being fired right now because they all have information. Before, people could have been fired because you missed coming to work, people being suspended because as well they didn't have information. Mental illnesses is something which is not easy to understand, and unless you take your time, you might think that someone is assuming or someone is just joking, but it's real. People are really suffering. People are really going through trauma, even from our workplaces, back from their family and from where they're staying. So I really acknowledge this program because even our team has really accepted us the way we are, and they have acknowledged that mental illnesses is true, and our team is really suffering. And even right now, we are really struggling to look for money, maybe to take even our staffs for what do we call it? Maybe games, maybe over the weekend, people go out, retreats, that kind of thing, so that we can heal together. Not only me, Mama G, healing, but we also have other victims which also need that process and healing process. So we are still struggling to looking at fundraising, if we can get more funding for, and not only for general activities, maybe for retreats, that kind of things as well. Thank you.
Thank you. And it was, I think it's so valuable to hear about kind of the multiple effects of supporting mental health and investing in those services. Like you said, increased uptake of condoms and lubricants as people are
and ARVs as well.
Oh yeah, antiretroviral medication for HIV. I mean, it's so important to have that interconnection between mental well-being and physical wellness and health.
What we also realize when people are really going through mental illnesses, majority defaulted and stopped taking and stopped coming for ARVs at our facility. But after these sessions, we've realized that the number has really gone up. Yes, so it's also a plus for us because we don't want to see our community members dying because of mental illnesses. You can imagine mental illnesses and HIV, you being positive and taking drugs at the same time. This person, there is high chances for him defaulting for not taking medication, because that's the only thing that they are seeing when people are suffering from mental health. You just think that you need to die, but that is not the case. We want to see our people growing. We want to see our people healing and working as usual. Otherwise, thank you. And if you have any question, please feel free to ask.
Great, thank you. And Brandt, you've been waiting patiently, listening to your colleagues. I'm sure you have a million things that you want to jump on. I'm going to ask you my question, but of course, if there are things you want to pick up on that Wari or Mama G spoke about, we have a few minutes. I do have one final question for everyone as well. But my question for you, I have a little bit of an intro to it. So as you know, one of the key goals of this project that we're working on together is to support LGBTIQ movements for health, including mental health and human rights in Uganda and Kenya, as well as across the African continent. And the 6 organizations that are leading this project, as well as the SLF, will be working to develop a mental health toolkit at the end of the project to make sure the learnings and resources are made widely available. And so I was wondering if you can tell us a little bit more about the work that IBU is already doing with other organizations to support each other and build human rights movements, as well as what your hopes are for movement building moving forward.
Okay, thank you so much, my colleagues, Mama G and Biggie. That was really informative. And actually, I've taken a lot from their presentation. One, as Icebreakers, we don't believe working with isolation. When this project came up, we sat down and we actually came up with strategies on how to work with other organizations. One, many organizations don't have mental health services at their centers. What we did, we signed a memorandum of understanding under the mental health chapter whereby we shall be taking services, or we're taking services closer to their organization. For example, if an organization has a mental health outreach, we just organize and then we take all our mental health services to them. So that will enable them, also benefit, but not coming to our space as IBU, but also feeling as if they are owning their mental health services. And this actually is seen in actually very many clusters. For example, the cost implication, for them, because they will not be incurring transportation to come to Icebreakers Uganda, and also to share, to partner building or strengthening, whereby we have actually conversation outside mental health outreaches. And we've done this for at least, I would say, for more than 5 or 6 organizations. And then most of them have actually, we have even started writing concept notes together, the consortium concept notes together for mental health, to ensure that actually at least there's data consortium kind of thing or touch of things when it comes to working with other organizations. And we also actually provided space for other organizations to come actually take up their service. For example, if someone is holding a certain activity and they don't have money to pay for venue, they just write to us, and then we give them venues. For example, we have a memorandum of understanding with the Trans Equality Uganda. That's a trans women-led organization that actually they have their sessions every Saturday and Sunday every week. So they wrote to us asking for space for them to carry out their activities, and we responded positively. So it shows that actually that we're building movement, and then you want unity, because you rather know how I might be working on transgender persons, but there's an organization that leads with transgender organizing. So it's a matter of actually working together to see that the agenda, or to see that the agenda is driven back alone. We also I've said we host organizations, because IBU, it's we are lucky we have at least some big space. So we're able to host organizations that actually are coming up. Some organizations, they have money to pay rent, they don't have money to bring out to come up with structures. So we always actually host them actually until they can stand for themselves. And actually of recent, I attended an AGM of one of our organizations we hosted, and actually we even won an award of actually being the first person to host them. So we really see that actually we work together. And in Uganda, you cannot never work alone, because first of all, you have a challenge in security, and you might need someone. If you get in security breach, you might need someone to call. I might be with a big mouth to speak about mental health, SRHR, but then I might actually be fearing speaking to police. So we really have those partners that actually work closely to see that our agenda is passed. And now actually we're conducting internship for people from college and universities under the mental health services. Of reason, we've taken in 2 persons to come to that coming to IBU to do internship under mental health. So this shows that actually really the work we're doing is out there and people are really responding to them. We have the famous toll-free line, whereby it's not only for IB, but it's for our LGBT community. If you need any service, someone picking that toll-free and call. And we have a report that actually in the last 2 months, we've reached 200 people on toll-free line, which is a good thing, and not from Icebreakers members, but all for all the LGBTI community in Uganda. We also have an online event that is Ask the Doctor, whereby we always actually ask all our community members to ask for a doctor. You might, some people fear to come at the center, but then if they talk to a doctor, they're comfortable talking to a doctor and then getting solutions. We give that actually, that also initiative to all the community members at the LGBT community. When COVID came to play, we came up with that online clinic, online response team, whereby we provided everyone with airtime. And you saw that actually most of the few organizations that were open during COVID, that operating, Icebreakers was one of them. Because Icebreakers, we operate the first ever LGBTI clinic in Uganda. So we saw that actually we're serving very many community members from from different organizations. And as I conclude, as I wind up, I wanted to also talk about it begins with us. Because as IB, we do a lot of things, but what of us, as Biggie said, and Mama G, what of us, the actors? What are we doing to ourselves? So it's under this project that actually we got the first funding of its kind to hold actually mental well-being and health camp for staff and peer educators, whereby we went away from our workplaces. People said, you know what, one of the guidelines were like, no one is moving with a laptop. Yeah, let us go, rejuvenate, rethink, strategize, argue, re-argue, sort conflicts of interest, so, not conflict of interest, sort conflicts at work, and then come back fresh. And many of us, we got to know how to be in the same place. It was like a big brother's house, whereby we had peer educators, we had security officers, we had the executive director wearing short shorts and dancing in front of, and this really rejuvenated. Now, everyone was like, when they were doing our evaluation at the last day, like, okay, we need it like twice a year, of which cost implication. But then, by the time we went back to office, everyone was actually in a mind how. And we have a quarterly debrief, staff debrief, whereby people come out and say whatever they want to say. So why they're underperforming, out why they didn't show up at work. So that you can see how to get the words. Because yes, I'm Brandt. I have a lot on my head. Yeah, I have problems. I have responsibilities. I have work. By the time Monday reaches that office, I might not be in my right mode to what. So this debrief always actually helps us to refresh, rethink, and strategize so that we can say serve a better future. I'll end by a quote, which says, "Party is not wearing shoes. Party is just dancing on a party. Party is not actually being on a table, but party is a dancing. It's dancing." Thank you so much.
Thank you so much. And this is, we could go on. I could keep you all for at least another hour, if not more, but we did commit to both you and to the folks attending that they would get to leave soon. Although I'm sure the attendees would stay if they could. So I just want to wrap up, give you one final word briefly. If you could each choose one hope that you have for this project, what will have changed? What do you hope will be different after 2 years of this project? Very briefly, let's start with you, Biggie.
I believe I like quoting that gentleman who says of America, but I'll just use in terms of wellness and service provision. This project has run for the shortest period of time, but the impact of the project is overwhelming. The way we associate as staff with the peer educators who run around, there's a photo that was shared for peers and staff members of Freedom and Roam during COVID. That is an army. That's selfless. They went out there regardless of the situation, but they had to deliver services to the community members. But they had to make sure that people are getting their ARVs. They had to make sure that people are getting food, nutrition, but also responding to emergencies. So in the next years, the collaborations and connection between the peers and the staff, there was some gap between the staff and the peers, is breaking, is reducing. It's more of it's a family. We collectively do everything together. I look up to you, you look up to me. It's never one-sided. How you ride your bike, like one of our best peer leader, who used to ride, she used to ride everywhere to deliver ARVs, to deliver food, to pick up people who are unwell. We can do it if we emulate what she did. You see, the gap between us, the peers, the members, but also the beneficiaries is reducing. We are getting into a solidified family that looks out for each other, but cares. Looking at me as a director, at the end of the day, if I'm calling you to make sure you're okay, you also call out on me. Call me, say, Biggie, I saw there was this police statement. Are you okay? How can I help? Can I just speak to you? You know, collectively, we care for each other more often than what we used to see. And I believe it's going to be better than what we see now because it's growing at a higher rate. We'll love each other more. We'll deliver to us more with love and caring because we understand what we all go through to do what we do. As a director, as the staff of Freedom and Roam, as the peers, but also as the beneficiaries. Thank you.
Thank you so much. And Mama G, what about you? What is one of your hopes for this project?
Thank you so much. What I would like to see as a human rights defender is increased awareness of mental health and well-being amongst my community members. Thank you.
Thank you. And for you, Brandt, one of your hopes for this project?
IBU becoming the model clinic for mental health in Uganda. That is my hope after this project. Thank you.
Those are beautiful, beautiful hopes, and I think realistic given what you've shared with us today about how things are going so far. I don't know about everyone else in the audience, but I know that I'm feeling ready for Pride. Lori, what you shared about kind of the family and the connection, for me, that is so much what Pride is about. We need it. It's been a hard couple of years with COVID. And, you know, thank you for everything that you've shared today. Thank you to our audience for joining us, for everyone who took part and Dare to Self-Care. We'll have opportunities for you to learn more about this project, hear again from these three organizations and also from the other three participating over the next year and a half. And thank you for joining us and giving us this time. And until then, good afternoon and good night to everyone.